we need to be doing research on health. This has been a huge need look, over the years, I've met Director Generals of Health in New Zealand. Dr. Hiddleston was one who, again, would have been sometime in the 80s, maybe it was the 90s, you know, I forget, but I went to a committee, gave a presentation to about 20 members of a committee at the Ministry of Health who were involved with new treatments. And I specifically talked about physiological effects of meditation, right? Because there was a lot of published research. You get a very deep rest when you do meditation, and there was, you know, there are huge health benefits to that. It's much deeper than sleep even. Anyway, I presented for about an hour to the committee, and you know, the research is very extensive. The research on reducing blood pressure, improving immunity, reducing incidence of cancers, and so on. So,
well, it's well known that anxiety increases cortisol, and that cortisol in the brain reduces the effectiveness of our immune system. And we all know that for 2 years now, we've had a government that's been ramping up anxiety, really ramping it up. So it is proven from brain studies, isn't it, that there's a reduction in cortisol release in the brain from meditation.
And look, what happened after the committee was absolutely crucial, because the head of the committee, this is the committee that recommends new things that we could be doing in New Zealand, put his arm around my shoulder, and he said, you know, Guy, he said, we're never going to do this. He said, because, he said, if people get more healthy, the doctors will have less income and they won't like it. And that is what we have faced in New Zealand, a paradigm that wants to be exclusive, a medical paradigm of a sort of magic bullet philosophy that is, you take a pill and you can go on doing whatever you're doing. It doesn't matter, you just take this pill, and it doesn't matter if you're a naughty boy, you'll be okay. And it's not sufficient. And we've reached, what I see about COVID is we've reached a crisis in health. Our modern way of life and diet has reached a crisis point where, as a human race, we are vulnerable to diseases because we are not healthy. And this is the time that we have to say we have to change. We don't have any other alternative.
It's profound. We've often talked about this in our group as we build it. This is a time to become really adult, to step up, no longer a teenage kind of thought of I'll semi-hand over my sovereignty, my authority to someone else and wait to be told what to do. We have to be adults. That includes in our health. We can't go and hand our health over to a doctor, or let alone big pharma. And in mentioning the doctors, we don't talk about how big pharma totally depends on a sickness industry worldwide rather than a health industry in order to return its massive, massive profits to its shareholders. So there is a clear fault in the way the system's set up. I'm going to go back to that 15%. I found that passage. You said 15% of people fully exposed to COVID never got it, and yet they were absolutely having COVID coming at them. So you were talking about sleep, meditation, good diet. Is obesity a big co-risk factor in getting? Yeah.
I mean, I think the way I look at it is that, the physiology has a certain amount of flow in it. You know, it has structure, it has transport, it has structural systems that hold us together, it has transport systems, and it has transformative systems. You know, our digestion is a transformative system where we transform what we eat into the structure and function in the physiology. And if, you know, obesity is connected with a sort of a sluggishness in the physiology, a sluggishness in the digestive system, and that translates into a sluggishness with our immune system. Our immune system struggles, it's sort of, in a sense, it's blocked. I mean, I'm trying to use terms here that are readily identified in everyday language, and that's you know, that is a huge factor. Yes, if you have high blood pressure, yes, if you have autoimmune disease, yes, if you have diabetes, yes, if you are obese, these are all risk factors. And they're things, honestly, they're things that we can do. We can do something about these things. We can change our lifestyle. And people sort of dismiss these. One of my correspondents dismissed it as saying, oh, I don't think anything else will really work as well as vaccination. But in fact, they will.